I'm going to demonstrate how to do a subcutaneous injection using heparin and an ampule. So I have all the supplies I need here except for my gloves. So I'll get those right now because I'm going to need them here in a minute. So the first thing I'm going to do before I administer medication is my 6 patient rights to medication administration. So I'm going just to verify that I have the right patient, the right medication, the right dose, the right route, the right time, and that I document at the end of the demonstration, or at the end of the administration. The other thing I'm going to do is I'm going to check the medical administration's record and just verify the medication in the system with the patient, and also just verify that the doctor is still ordering the medication. So once I've done all that, I'm going to go ahead and open my ampule. So I'm gonna shake it a couple times using the wrist flick, and I'm just gonna make sure that I get all the medication out of the neck of the ampule. And once I have that done, I'm going to go ahead and use some gauze. Then I'm going to wrap the gauze around the neck of the bottle. And I'm going to go open the ampule away from me. And once I have done that, I'll dispose of that. So once I have that done, I'm going to go ahead and get my needle ready. So I have a 1 milliliter syringe here. And with a 27 gauge needle, I'm going to go ahead and take the needle off of the syringe without touching the end of the syringe. And I'm going to go ahead and place my filter needle on my syringe. And so I'm going to go ahead and hold my ampule and place my filter needle in my ampule without touching the neck of the ampule. And I'm going to go ahead and draw up 0.2 milliliters of fluid. Tricky. So once I have my 0.2 milliliters of medication there, I'm going to go ahead and dispose of my ampule. And just be sure I have 0.2. So I'm going to go ahead and dispose of my ampule and my filter needle, and then I'm going to go ahead and I'm going to draw up 0.2 milliliters of air. So I should have 0.4 total, which is what I have. So I'm going to go ahead and place the needle back on my syringe. Now I'm going to go in and meet my patient. And I'm going to introduce myself and verify the patient with 2 forms of identification, name and date of birth. I'm also going to verify any allergies that the patient might have. and explain that I'm going to administer heparin as per instructed by the doctor. The most common place to administer the heparin is in the abdomen, about an inch away from the belly button. And I'll just go ahead and grab a fold of belly there and administer the heparin. And once we've talked about that, I'm going to go ahead and wash my hands. And I'm going to put on my gloves. So, and then again, I'm going to use some alcohol, and I'm just going to swab the area. Again, it's 1 inch away from the belly button and the abdominal area. You can also give it in the arm, but the abdomen is most common. So I'm going to start at where I plan to inject and move in a circular motion, moving the dirt away from out towards the edges. I'm going to go ahead and open my needle. I'm going to hold it at a 90-degree angle, and I'm going to go ahead and inject it into the skin. I'm not going to aspirate. I'm going to inject the medication and the air will hold the medication in the injection site. I'm going to remove it and place it in the sharps. I'm going to go ahead and take off my gloves. I'm going to wash my hands, and I'm going to document that I administered the heparin, the dosage 0.2 milliliters, and that I administered it in the abdomen, and the date and the time. And that is how you do a subcutaneous heparin injection from an ampule.